By the age of 60, you only have one stem cells out of 800,000 live cells. So obviously the immune system will be totally compromised. Everyone will say their stem cell work the best. There's a lot of scams going around. Everything must be supported by scientific and medical background.
Welcome to the second part, the second session for today. It's entitled It's All About Graceful Aging. And let me introduce to you, he is currently the senior researcher and technical consultant for the European Wellness Group in Europe. He is also chairman, founder of the European Wellness Center, chain of 25 hospitals, wellness centers in Germany, Switzerland, Greece, Thailand, the Philippines, Malaysia, China, Cambodia, and many more. A revolutionary in the field, he is an esteemed Academy speaker, presenter, keynote speaker for more than 1,000 lectures, seminars, conferences, and symposia across 60 regions worldwide on the topics of anti-aging, regenerative medicine, and stem cell therapies. He is also author and co-author of a number of books and publications of the subject matter and is widely credited for bringing cell therapy and biological medicine into the Asian Pacific regions by establishing educational programs for physicians and healthcare practitioners that are respected across the globe. His topic for today would be stem cells, peptides, exosomes, and autoimmune therapy, why some work and some don't for COVID-19, chronic untreatable diseases, and autoimmune disorders. Please welcome Professor Dato Dr. Mike Chan.
Hi, everyone. It's good to be back and it's live here. I'm right in my office and I'm doing live. I love to do everything live so we have a lively feeling. Okay. All right. I'm going to turn on my PowerPoint. Can you see the PowerPoint?
Yes, we can.
Okay. All right. Today we're going to talk about the stem cells and the peptides and the exosomes. You have been hearing a lot about stem cells, peptides, and exosomes all along. And of course, we're going to touch a bit on the autoimmune. Due to the time constraint, I have to go in at a very fast speed. Okay. Now, overall, you have to understand. Everyone is talking about stem cells, but sometimes not every stem cell works. It's still not a wonder treatment for all. It depends on what you need according to the condition of the patient. Now, basically, the background has been in this field for the last 35 years. We start everything in the lab, and then we move on in Germany and Switzerland in the lab, and then from there, we turn into manufacturing. And the last 10 years, we move into acquisition of hospital in Switzerland, Germany, and Greece, and many parts of the world. Today, we are around 25 centers across the world. All right, and we've been all the time doing a lot of education program over the place. Now, basically, you have to understand stem cells. First, you have to understand that in the human body, you have 220 organs and tissue, okay? And out of these 220 organs and tissue, there's a lot of cells. You have around 37.2 trillions of live cells, okay? And out of this, there will be some stem cells. The stem cells in your body will be the fullest up to the age of 2. You'll be having one stem cells out of 10,000 live cells. But as you age, you're aging at a very fast speed. And you will realize that by the age of 60, you only have one stem cells out of 800,000 live cells, okay? And again, you will realize that you're aging at a very different angle. The angle is getting more acute over time. When you die, you don't have any amount of stem cells. Look at the chart here. By the age of 18, you only have 40 to 45% left of your stem cells. And by the age of 30, you only have 25% left. So you can understand with the case of COVID, those under 60, they only have 5% left of the stem cells. So obviously the immune system will be totally compromised. It is for these reasons, that we have to be extra careful with people 60 and above, because you have small amount of stem cells. You have also, in other words, a lesser, stronger immune system, less stronger. Again, with the stem cell, you've been hearing so much from so many different people. you know. And sometimes you yourself as a physician, you're getting very confused and you do not know what to recommend to your patient too. You know, everyone will say their stem cell work the best. Now, this is a general chart of what I have compiled. It's good for you to take a picture of this so that you can have a better understanding of what stem cells is about. Overall, as a lab manufacturer, we produce all this in Europe since the mid-80s. When we started stem cells in the mid-80s, no one really understands what is stem cells. We started to bring stem cells to Asia in 2002, being the first party to do that. So we basically start everything with the human stem cells right in the Soviet Union and Germany and Austria in the old days. And then we move on also to the animal. And recently we are going to introduce the vegetal stem cells too, okay, which has been in our picture for many years. We will launch it officially next month. Now, overall, look at this chart very carefully. This is one of the most important charts in the lecture. Now you have embryonic stem cells and you can see there's some limitation here. It's pluripotent, then why don't we use the word embryonic stem cell? Pluripotent means you can differentiate and turn into any type of stem cells. But there is a risk here, just like a cancer cells. Cancer cells are pluripotent, so they may malfunction and turn abnormally. So there is always a risk here, apart from the ethical reasons, because you have to take it from the fetus. You know, that means you have to encourage abortion. So again, with Roman Catholics and a lot of ethical reasons, we cannot do that. Now, again, you heard of autologous. I take it from your blood, you know, and the problem is your cells is as aged as your biological age. The cells of your organs, including your organs, are as old as your biological age and not your chronological age. So like me, I'm 60 years old today. That means to say my cells of my different organs could be more than 60 and some could be younger, all right? So we look at the biological age. So if you were to take from my cells of autologous blood, it won't be a good quality cells. What about my grandchildren? They're younger. Yes, the quality will be better. And we call them the allogenic cells there. Okay, it's not shown here, but we call it allogenic. Now, again, you heard a lot of news about iPSC, induced pluripotent cells. We are always in constant contact with all the top scientists in Europe. And the last meeting we had recently is that even with the promise, the good promise of iPSC, the Japanese got a Nobel Prize winner for iPSC, Yamamoto, but you also have to understand the reality has not arrived yet. The reality will be 20 to 25 years. You're taking from the bone marrow, the mesenchymal cells to turn into the pluripotent stage, you know, and then return it back into the precursor or progenitor stage. This magic has not been done. So if someone in the internet would say, oh, we are offering you iPSC cells, it's not true. It's not iPSC cells. They have to prove it. Everything must be proven. It's not just on the internet. You cannot rely everything on the internet these days. There's a lot of scams going around. Everything must be supported by scientific and medical background. And they must be supported by some studies or some journals. Again, moving into bone marrow stem cells, they has been ongoing for many years, you know that. But again, you have to understand the word is multipotent. Multipotent means they will turn into certain amount of cells, normally around 7 to 8, and these are tissue cells. Because anything coming from the blood will be only tissue cells. That means it cannot turn into organ cells. Tissue cells will be for the chondrocytes, okay, the cartilage, those you can, but not the rest. You don't expect this to turn into a brain or a neuron or eye cells. It will never go there. Umbilical cord blood, again, is multipotent again. So it means to say that it can only be turned into the tissue cells. It doesn't matter someone were to tell you, I give you the Wharton jelly. It's the best from the umbilical cord blood. Or I give you the best stem cells from the umbilical cord blood. You have to understand it's only for blood disorder. It'll be good and not for specific diseases. You don't expect them to turn into the brain. In the brain, you have 67 different types of brain cells. Imagine that. You have 52 zones in the brain. So the brain itself is one organ out of 220 organs in the body, have so many different cells. You want to treat Parkinson, you have to give the substantia nigra. You probably have to give the frontal lobe for some people who's losing memory too, for Alzheimer's patient or even for autistic children. You again have to give different types of brain cells. Now, what about adipose-derived stem cells? This is coming from your fat, and some of you has been doing that in the Philippines and across the world. Again, from the fats, what do you get? You will get the mesenchymal cells. Again, with the mesenchymal cells, it's multipotent again. So there's limitation, a lot of limitation. So what will be the best way to go with? The best way, one of the way which I came across is that you can use the progenitor cells, or we call it the progenitor or the precursor cells. That means they have been in one, they have already been in the final stage of differentiation, just before the fetus is out as a child or baby. You know, you take it from the mother and you have to take it live. It doesn't mean you have to kill the mother. You can go by C-sections. Okay, these are unipotent cells, most of them, except for some which are multipotent too. So from here, you have a vast range of 400 different types of different cells to treat a patient. If I'm going to treat someone with the liver has 75 different types of cells. So what will be the best cells in the liver? The hepatocyte. Give the hepatocyte for cardiologists, for heart problem. Give the cardiomyocyte and not the rest of the other sites. Again, for kidney, CKD4, CKD5. What is the damage here? The renal cells. Give the renal epithelial cells. Go for A for A, B for B, C for C, and never for A to Z. You must throw the dart at the bullseye every time and hit it bullseye, then you have the best results, okay? Now, let's move on here. Generally, we have 12 body systems in our body, okay? And they're all comprises of organs, okay? And inside the organs and the tissues, you will have, inside the organs, you have the cells and the tissues. Now, in other words, what I'm trying to say is, to reverse aging to a certain extent, to delay aging to a certain extent, you must repair at the cellular level. It must be at the cellular level because the cellular level is aging very fast. So that is the reason why you must practice cell therapy to a certain extent, okay? Now, look at the organs. You are aging at a very fast speed. Your brain starts to go down at 20. While the frontal lobe is only fully developed at the age of 26. The lungs is going off at 20. You know, the skin is going off at 20. Your muscles is going off at 30. The fertility at 35. And you start to, you lose your hormones by the age of 40 by 1 to 2%. So there's a lot of things going down. After 40, you are losing 10,000 neurons. They will never come back. And you know neurons generally are not regenerative. It's not like a liver cells you can regenerate. So in other words, you are aging and one of the organs which are affected or two of them will have a domino effect on the whole body. So you have to make sure the whole body is in good condition and well maintained. Reverse the aging to a certain extent, not by 20 years, is quite impossible in my own dictionary. I sincerely think you can reverse aging by 8 to 10 years with the help of your organs. And then you do the delay in the progression of the aging. Delay it as much as possible. That's why if you're going down at a very sharp angle, move it up, reverse it up, you go constant, and then you start to drop again, push it back. So you are driving a Lamborghini, accelerating at a very high speed, and then you press the brake and you re-accelerate again. Or you have an angry dog, you hold the dog is rushing out, you pull it by the string, and you are rushing again. And what are you doing here? You are stopping the momentum. You are changing the momentum here. The same principle will go for aging here, okay? Now, again, I just mentioned you have 67 cells in the brain. You have in the pancreas itself, you have 13 cells. So let's talk about diabetic patients. What is the problem with diabetic patients? The islets of the Langerhans is needed. You don't give the whole pancreas. You want to have the best result, give the islets of the Langerhans. You can give the stem cells, you can give the peptides, or you can even give the exosomes. And everyone is talking a lot in exosomes today because it spread to US. In 2011, in A4M, when we produced A4M Las Vegas 211 or exosomes, everyone was very fascinated, but no one really understand what is exosomes. But 2 years ago, when we went back to US, everyone is talking about exosomes. And the thing is, they thought exosomes is better than the stem cells. So my personal opinion is there's no way a secretion of a cells or a stem cells, which is the exosomes, there's another name, you can call it the secretones, they will never be better than the cells. You must use the cells or the stem cells. But when you give the cells and the stem cells, you are also giving the exosomes along the way, all right? So for that, again, the peptides. The peptides is only a component of the cells. There's no way it'll be better than the cells. And there's no way a cell will be better than the stem cells. The stem cells will be the best. All right, I also explained about the liver. You have 75 cells. Okay, again, the liver is a filter. The liver is also a dustbin. So you don't give the 75 cells. You only give one specific cells, the hepatocyte, and that will bring wonderful results to repair the liver. So we are working on the principle of what they have in naturopathic medicine, born in Germany and Switzerland in the 15th century and 17th century. Cell therapy go with the same principles. It goes also with the Chinese medicine. They always say, similia similibus curanto, like treats like. An A for A B for a B, a C for a C, a Z for a Z. Okay, you cannot use an A for A, B, C, D, E, F, G. You don't work that way. You have to go into very specific. I have a heart problem. I should be giving the heart cells, not the mesenchymal cells alone. I can give the mesenchymal cells. I can add the heart peptides or the heart exosomes or the heart cells or the heart stem cells. You can do that, all right? Because mesenchymal cells will do the stimulation, but mesenchymal cells will not home. That is important. You need the homing effect, okay? In 1909, the Halsted principles has already proved that it must be organ specificity. And in 90 years later, Bluebell Gunther won a Nobel Prize again to talk about cell signaling and homing. So it's important to go with that principle. So you have to throw your dart or your dart at the dartboard and hit it bullseye. Everyone you hit bullseye means you get 50 points accumulation. You shouldn't be hitting 0 point or 1 point or 2 point or 10 point. We want every dart. All the 10 darts you throw will be all at 50 points. You get the 500 points. That is the way to go. This is how I look at it, all right? Now, again, these are some of the pictures coming from us. We have thousands of pictures where we do experiment with human stem cells. We do experiment with animal stem cells, predominantly with sheep and rabbits. When we are talking about sheep and rabbit, we are talking about FDA-approved SPF or VAF, pathogen-free, virus-free animals. They have to come from US FDA, okay? And they will be shipped to Europe. And this is how we go. We are not taking the animals from the farm. That means these are exactly the same animals coming from Charles River, one of the world's biggest suppliers of animals for laboratory experiments used by all the top universities of the world, be it MIT or Harvard or Cambridge or any university. We are talking about laboratories animals. It's totally different, all right? Now, again, when we talk about cell xenotransplantation, now, the word is xenotransplantation is also very misleading. You should call it cell xenotransplantation because you're not talking about the organs here. When you have organs, even with human, there'll be rejection. When you do with the cells, you will never have rejections of the cells with any animals. Man sitting on the top of the animal kingdom. In the fetal stage, cells of all animals, including man, sitting on top of the animal kingdoms, they are alike. Because man is the most intelligent animal. It is still an animal. It is still under mammalian cells. So that is something you have to understand. Now, Japan, one of the top countries in stem cell research for mesenchymal cells, they won a few Nobel Prizes. Recently, the Americans also recognize them very much in terms of mesenchymal cells, okay? Japanese has been quietly doing stem cell research on animals to human. There are 110 publications and research articles only from animal to human to prove it's totally safe. And this is not done just by Japan. There are many other countries who are doing it quietly. Why are the Japanese moving a bit into the animal side? Okay, and recently Japan last December approved all the animals injectables from our company manufactured in Europe or sold in Japan legally. It's approved for all the doctors' usage. Because the Japanese government themselves say for many years since 1995, they have been doing a lot of diabetic patients. They need the islets of the Langerhans. They cannot get it from the mesenchymal cells. The mesenchymal cells only do the stimulation. So they must repair by organ to organ. And this is for this reason they use pig, because Japanese are pork eaters. They don't have the experience with the sheep or the rabbit. Okay, if you were to ask me, I would say the rabbits will be the best because rabbits has been proven retrovirus free. They don't spread disease even to a different species of rabbit, let alone man, and they're very discordant from man. All right, moving ahead, we have so many other publications. We have a publications all over the country. Even in US, they are quietly moving into animals too. We are working with MIT in our medical team, and we are working with Harvard, we are working with University of California, we are working with Heidelberg University in Germany, all relating to animals too. Now, I'm not pro animals or human. I do everything. I supply humans, I supply animals, I supply vegetable too. The important thing is, as physician, I sincerely think you have to treat the patient. The first thing is first do no harm. The next thing is the potency, to what level you can treat with results, because your patients always expect fast results, okay, and they expect the right results. Now, again, these are a lot of publications going on because of the limitation. I cannot show all the countries. So there are certain questions of you as physicians you must always ask. What type of stem cells are they? Are they really cells or stem cells? Or are they just peptides? And someone is telling you these stem cells. If someone give you a wire and tell you this is a stem cells, and it's not frozen and it's been out from the lab for more than 3 days, it cannot be stem cells. There's no such thing as stem cell cream or stem cell shampoo. It won't work that way, all right? Cells means they have to be in an environment where they can only last for 72 hours in the Petri dish. After the Petri dish, you must inject within 72 hours. Otherwise, you have to preserve them at ultra freezer. Just like what Pfizer is doing now with the vaccine. They come in -70 to -80. So you need a lot of ultra freezers for all this. Again, if someone were to ask me, should I give you a frozen cells or I give you a live stem cells, which has been procured and cultured? I would prefer a live one, because when you froze something, there will be damages on the cellular structure. Okay, the cell membrane will be damaged, although there are still cells, but a number of cells will be gone. Now, how potent are the cells? You must have something to prove. So you have to ask for documentation. I must have a certificate of analysis from the lab. I must hold the lab responsible if something is not right. Because at this moment, a lot of physicians are buying cells where they don't have anything. They just tell you, I have taken your blood and I turn it from 20 million to 200 million. What is that? We are not talking about the quantity here alone. We need to know the quality of the cells, which matters more. Because all the cells moving into your body will divide. The divisions of cells to be inside your body and not on the outside. You divide it and then you have a more amount of cells and you inject. Now, if I were to increase the temperature of the cells by even 1 degree, the temperature will push the cells to multiply. Just like putting you in the hot weather, you run and walk faster. And in the cold weather, you tend not to run so much. Okay, again, you have to check, are they really stem cells? So all this must be done with the lab report to prove and hold them responsible. Just like in the accounting, you must have an audited account. Or you build a building, you must come with architect and engineer report. It's the same there, how safe they are, you must always ask these questions. So this is some of the things we do with validation of the cells. Okay, these are some of the equipments, and some of the PAMI members, including the committee and the chairman and Gisela and the rest of the team, they have been to Kota Kinabalu. Even in Kota Kinabalu, we don't manufacture the cells, but we have a training centers where we have been training doctors coming from USA and from all parts of the world, including Europe, because training in our place, especially for PAMI members, are given free of charge so far. This is a special privilege only for PAMI members at this moment, okay? Now, we will work something more with PAMI on this, on all the different types of graceful aging and other topics. Now, again, with certain equipments, you can trace a lot, and all these equipments are found in our European site, and even in our Greece site, and even or in Germany or Austria, and even in Malaysia. We have a 6 million US lab built by the Germans for 6 months right in Kota Kinabalu, Malaysia, which is 1.5 hours away from Manila. These are our copyright pictures, and this is where we can validate what type of cells they are, whether they're really pancreas or adrenal cortex, on all kinds of cells. You must have pictures to show too, okay? The potency can be measured by cell counter. Again, you have some cheap cell counters, and you have some very advanced cell counters like Muse here. Okay, we use all the cell counter. We use 3 cell counter to validate what we have. So whether it's the peptides or the cells, we must have something to prove to you. Again, and we have to do sterility testing all the time and toxicology. Now, again, the source of the animals, they must be SPF, VAF. VAF means virus antigen free, and they must come from US approved sources. We don't buy from any other sources. It had to come from Europe. It had to come from USA to Europe. Okay. Again, with the human materials, you also have to understand the mother gives birth to the baby. Okay. You have to know to a certain extent the history of the mother, because we need to know the source is coming from the mother. But most of the time, you're supplied with mesenchymal cells where you yourself do not know where the source are from. So there's a risk element there. You have to have some history about this. Same for the allogenic too. If it's coming from your family members, it's easier. What if it's coming from somebody else? Again, there's a risk element here. So it's high time for us to ask questions. All right. Now, again, everyone can say, oh, I'm having the best here. Please ask for proof. I want a proof coming from FDA or some sources that you have some certifications to prove you are out of those animals. So all these certifications is important. All right. Now, this is a general term for SPF. I already explained. They're free from all the pathogens. WHO require 50. We are providing 75, more than what WHO is asking. In terms of the generations, when you talk about rabbits, we have 400 over generations. They only require 25. We have 400 since 1973. In terms of sheep, we have 50 generations. So it's much more than what has been required. Now, Charles River is the world largest supplier. You can Google it and you will find a lot of things there. All right. Now, manufacturing process is important. Some of you has been to my clinic or hospital in Germany, okay? And I took over Villa Medical in 2017. I was the ex-owner of Paracelsus Clinic, and I still have a clinic in Lugano, and we have a lot of manufacturing in Switzerland and Germany. Whenever you're in Germany, to a certain extent, we can arrange some trips down. You know, we should arrange something for PAMI members. It could be an educational tour at the same time. Go to the hospital, check all the biological way of treating a patient, visit the lab or the manufacturing plant. You know, again, logistics is important. Storage is important. This is general guideline that how the manufacturer can make money very easily. 160 fetuses can be 1 5 ml wire, but the same wire, the same fetuses, I can create 8,000 wires. So if I were to give you 8,000 to 8,500 wires and sell you cheaply, but what's the point? You inject 100 times, you cannot even get a result of one jab. Then it's useless. But that is how marketing is going around. You know, you must ask for documentation to prove how efficient they are. This is my general guideline to you when people are asking a lot of questions. Hey, which one is better than which? This is our lab analysis of what we are offering to others. And this is what we have here. So we have the human, we have the animal, we have everything. Sometimes we use the human and animal together. Sometimes you only use the human. Sometimes we use only the animal. It depends on the situation, okay? And also it depends on the financial situation of the patient. We cannot say, oh, you don't have the money, we don't treat you. No, that's not the way to do it, okay? You can either give a Lamborghini to reach a distance within 2 hours, or you can still give a Tata car which you reach it in 12 hours. So if you have fatty liver, I can treat you with the 12 hours. But if you have a liver cancer, probably you have to go at a faster rate, you know, because we are running against time. So this is, again, there are a lot of solutions here. We have 400 over different types of targeted organs, tissues, cells, of stem cells, or peptides, or exosomes. You name it, you tell us what you need, we will produce according to your solution. Again, we can tell you about how to blend it well. Now, we offer courses for all these. All these courses are free of charge for you to understand well better. I know this is widely an aesthetic group, but I see dermatology here. So there's a lot of things we have to treat from the inside too. It's not just the outside. We have to treat from the inside because problems like psoriasis is autoimmune. So you have to solve the autoimmune problem too. And don't expect just the stem cells to solve autoimmune. If someone is telling you we solve all the autoimmune with stem cells, no, you have to blend them together. Certain cells can be for autoimmune, but you still have to create certain things to treat autoimmune. Now, again, for exosomes, these are coming from human base. I know there's still people who say, hey, I am a human, I must have a human. I cannot take animal, but they've forgotten that they've been taking animal meat all the time, every day in their diet, okay? And all the diabetic patients are injected insulins, those chronic diabetic, these are coming from pigs and cows. Okay. Now, again, we do have animal, but it's limited. We do have animal and we do have human, both. Now, in the case of human, how do you procure the organs? It comes from lab in USA. They are frozen and they are shipped over to us to do the manufacturing. We have to culture them, but this requires a bit of time if you want organ specific, and we cannot culture all the different organs because you have limitation of human. So that's the problem. Again, coming back to immunology or cancer, there's a lot of things we can do here. These are some of the treatments, but today our topic is not on immunology, although cancer is also autoimmune. But I would like to touch a bit on the autoimmune side. This has been there for the last 40 years in Germany. We have a number of patents on all this. Okay, we set it up in Austria and Germany on this. You have to take the autologous blood from the patient and extract the Buffy coat after the 4th day. Okay, take the Buffy coat. We only need the Buffy coat. We don't need the blood. Okay, and you cannot centrifuge. It must be natural. Okay, so take the Buffy coat. The Buffy coat will be then collected by us. Our people will come from Germany and collect it and fly it back to Germany. 1 week later, we will come back with the vaccine. This is a vaccine of your own, on the patient's own DNA of the immune system. The Buffy coat contains the DNA of the immune system. That's why you must treat. And your immune system changes every few months. You have to understand that. So that's for these reasons, this vaccine is only valid for 6 months. Okay, we have been treating a lot of psoriasis patients and a lot of autoimmune problems with this, including MS, multiple sclerosis, where you need the stem cells, the precursor stem cells together, the right precursor stem cells, plus ASI. These are some of the patents we have filed because we are moving in a big way into China and the United States and also in Europe. So we have to file certain patents to protect. These are some of our patents for the autoimmune problem and also for the stem cells. Now, again, with the autoimmune publication, we have 5 publications in the world, scientific journals. But overall in US, there's another 52 publications. So there are 50 over publications to support autoimmune problem here, using the autologous blood from the Buffy and taking it out from the Buffy coat to create the vaccine. Now, on our side, I only believe that you cannot rely on the publication of others. The problem with marketing is that I will use somebody's publication and I sell my product to you and say it works well because I publication. That is not the right way to do it. The right way will be you must have other people's publications, but you must have your own product publications. If you're doing a therapy of your product, it doesn't matter what kind of product. It can be a skincare, it can be a therapy, it can be anything from you. You must have publication to make it validated and recognized by the world body. So that would be international. And this is the principle we have been going around. And for the last 2 years, we have done 40 publications. Apart from a number of books we have been doing for this. This is on plaque therapy, good for your liver, heart, or even for the brain or for the kidney. All these books are available. This is a stem cells issue in 2019 last year. When we present for American Association for Stem Cell Physicians, it was all taken up, the book, and it was sold in Amazon. And for 2 months, we don't have books to supply to Amazon because we don't have books anymore. We have done a reprint, and this has been approved by the Fudan University. We have done in Hong Kong U and approved. We have all the ISBN internationally. It has already been approved in the Middle East too. All you need to know about stem cells is found in this book in general. We created the first stem cell book in the world, a medical textbook for doctors and physicians in 2006. This is an updated version 13 years later. Again, we have something for biological medicine. All the PAMI members can buy them at 50% the price. Just contact your PAMI committee member or contact James or Gisela. They will provide it to you at half the price, including of the postage. And we will give a personalized autograph for the book. And of course, recently we came out with a number of books which is on the way. We have sent it for submissions. One of them is stem cell and peptides and immunotherapy in regenerative medicine for animals. The problem is we are treating a lot of VIP patients. there have been 1,600 VVIPs from Manila and Philippines who went to our German hospital, Villa Medica. Okay, and part of that, they did come to Kota Kinabalu, they did come to Thailand, and where we also have clinics. And that includes your current president, who has been our loyal clients for many years. That includes your past 4 presidents, who are also our loyal client. That includes Imelda Marcos. So we have a lot of good relationship with Filipinos VVIP. They still continue to come. Now, again, with this, we also have a lot of VVIPs who have a lot of pets. So recently, I've been treating a lot of pets. We used to treat a lot of horses and even camels, okay, in the Middle East. But again, in Germany, we treat a lot of dogs. And so recently, we moved also into another department, another lab of ours who specialize with our vets. We treat only animals there. And this is gaining a lot of groundwork here. And this is the first stem cells for animals. Of course, there's many other books coming along the way. One will be on multiple sclerosis, okay, where we talk about the stem cells and also on the autoimmune. We are having one on autism, which is a world recognition body. I mean, world recognized publications coming in. And we have been spending 1.5 years to do it. And the next one will be on diabetes too. Now, basically, you have to understand, it's not just giving you the stem cells. The stem cell is for regeneration and rejuvenation. You must go with the 4-step. You must diagnose very rightly and accurately. That is important. That means I need to look at the lab work. I need to know at the hormones report. I may have to do a biological analysis of the patient. Next, you have to do the detox. If there's heavy metals in the cancer patient, you have to detox the heavy metals. If there are lipids in the body, we have to take away as much as possible. And if we find there's some problem with the gut, we have to repair too. Okay, because all these will have an effect on the patient overall. After this, we do a repair. You can have ozones, you can have all kinds of other repair, IVL lasers and all kinds. We have many types of devices here. If you come to Kota Kinabalu, you can see the full range of devices here. We have just set up a training ground of 60,000 square feet training academy in Kota Kinabalu. Okay, and the other ones will be in Athens in Europe. And next, the last part will be you regenerate with the cells. These are some of our centers across the world. And you can see there's one in Kota Kinabalu. We have the Villa Medical in Bangkok too. We took over and we try to promote as much as possible. We have a very nice one in Athens, right in the medical city. And it's been there for quite a number of years. So there are so many coming out. We are going to set up one in Ritz-Carlton. Renovation is on. We would like to work together with PAMI. PAMI doctors can treat this center as their own centers. For those doctors who are mobile, they don't have the equipment, please use the centers to provide it to your patient. It can be worked out in a way together, all right? If you think that you do not want to treat certain cancer patients, then you can refer the patients to. We have to share our knowledge and work together. We have to heal the world, all right? Okay, I'm finishing. These are some of the things. What I'm trying to tell you is there's a solution for almost everything. Okay, the time up or there's still time. Now, tomorrow there's been another lecture is on the hair, you know, and I will present on the hair. I'm 60 years old. In the next 1 month, and you look at my hair, I don't have any gray hair. I have 0 gray hair on my hair, and my hair is still very soft. There's a way to treat your hair easily, and you will grow baby hair. The baby hair is all black hair. You won't be gray hair. So I've done a lot of solutions. We'll discuss about this tomorrow. Okay, if you have any more information, please snap a shot here, and you can always contact me directly. I'll be more than happy to answer all the questions too. Thank you very much. Thank you.
Thank you so much, Dr. Mike Chan. That really was a very interesting lecture.